peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
To my fellow African diaspora, a very good day to all of you. My name is Ambassador Arikana Chihombori Kwao. Over the past couple of days, I've received many messages, emails, phone calls, and video clippings of the abuse that is being meted to our fellow African diaspora living in China. I've watched in horror Africans roaming the streets of China with their possessions after being evicted out of their homes simply because they're Africans. I've watched in horror Africans roaming the streets with their suitcases and at times with nothing at all, roaming the streets after being thrown out of their hotel rooms simply because they're Africans. I have watched in horror women carrying babies roaming the streets of China with nowhere to go after being thrown out of their homes simply because they're Africans. I've heard many stories of Africans who are married to Chinese being separated from their husbands or wives simply because they were Africans. I've heard stories about Africans being forced to take COVID-19 tests simply because they're Africans. In many cases, these individuals did not meet criteria for testing, or they had been quarantined for the specified time period as mandated by the anti-pandemic laws of China. Not once have I heard any complaints of any African disobeying the anti-pandemic laws of China. Why is it then that Africans are being singled out and mistreated? This situation is not acceptable. It is wrong, and it will not be tolerated. To President Xi, I say, while you have enjoyed good relationships with all the African leaders, it is precisely because of that that you should do the right thing. You are sitting in the big boy's chair, and we are asking you to make the big boy decisions. We are counting on you to make sure that the Africans that are roaming the streets and have been evicted from their homes be allowed to go back home. We're also asking you to make sure the Africans who are roaming the streets because they have been thrown out of their hotel rooms be allowed to go back to their hotel rooms. As we speak, President Xi, may I remind you that we have over 10 million Chinese residing in Africa where we have welcomed them with open arms. We have allowed the Chinese to establish themselves to marry Africans and live happily ever after in our Africa. Why can't Africans be awarded the same welcome that we have given to millions of your citizens? What is being done to Africans in China is deplorable, and the world cannot stand by and allow it to continue. While we understand that the majority of the Chinese are good people, they're good citizens in China as well as in Africa. However, sadly, among them, there are a few bad apples. A few bad apples that have chosen to give China a bad name. A few bad apples that are making China look bad in the eyes of the Africans. This is a situation that cannot be allowed to continue. President Xi, you are a good man. And we would like the relationship between China and the African governments to continue unabated. But the behavior that's coming from a few of your citizens will not be tolerated. And we're counting on you to do what is right, to do what is just, and to do what is fair. The Africans are no longer going to tolerate this abuse. From the Chinese or anybody else for that matter. The African youth are enraged. We're asking, when is enough going to be enough? President Xi, the power is in your hands. We value, as Africans, our relationship with China. Please do not allow a few bad apples within your citizens to ruin what is otherwise a wonderful relationship between China and the African countries. As a united citizens, as a united African citizens in the diaspora, We're asking you, President Xi, to do what is right, to do what is just, and to do what is fair. The children of Africa are saying, enough is enough. The abuse of Africans at home and abroad, be it in China or on the continent, has got to stop. You may not be aware of some of these abuses, but as a united African citizenry in the diaspora, we hope you will receive our message in the spirit with which it is being delivered to you. You are a good man, President Xi. We trust you will do the right thing. I thank you.
Very good afternoon to you, and thank you so much for joining us just a few minutes, about 6 minutes past 12 at noon here in Nairobi. Well to have you today, the 29th day of April 2020. The month is still here, and it has been one long month as we've never seen before due to the COVID-19 and the lockdowns and the curfews and all that. And we've been trying to grapple with our new reality. I hope that you are well, wherever you're watching us from this afternoon. A very good morning to you, or evening, depending on where you're tuned in across the globe. This is Diaspora Dispatches, where we get to look at the news-making headlines across the African continent. And also and then after I've gone through the news, we get to look at some of it in details. But first, my name is Miriam Ogutu, and I'll be taking you through the show, and Dr. Matanga shall be back with us at 2 p.m. as we look at another topic. So before we get into the news, I'd like for us to look at the statistics across Africa, the COVID-19 statistics, and where is Africa standing in terms of the number of infections here. So thank you so much. Keep writing. Ishmael J, I see you. Keep writing, and Melly, do that. Let me know where you're watching us from, and then we shall engage once I'm through with the reading of the statistics, and then later on the African news. And we start with Kenya, where the confirmed cases right now in the country is at 374. 14 people have died, 124 others have recovered. Sao Tome and Principe, confirmed cases is 8, recoveries there is 4. And if you've been following this, the statistics as we've been reading them here, Sao Tome and Principe is among the countries that were tested, the last countries that confirmed the cases in Africa. And for a long time it was at 4, and now we see the cases have doubled to 8, but also we see 4 recoveries. So my assumption is the 4 patients who were initially confirmed to have tested for this coronavirus have gotten well, and now maybe they only have 4 patients being treated for this. So the confirmed cases right now stands at 8. And South Sudan, which has really shocked me today, confirmed cases there is 34, because confirmed cases in South Sudan for a while had been just at around 4. 4 cases for a very long time, but then it went to 5, and now we see the confirmed cases there is at 34. Should that be a cause for concern? We shall look at that news as we look at the rest of the news items across Africa. And we go to Uganda, where confirmed cases is at 79, recoveries there is 52. Tanzania, confirmed cases is at 306, and the death toll there is 10. Tanzania in the morning had about 300 confirmed cases. Now we see it has risen to 306, and 10 people have died and 48 others have recovered. Central African Republic, confirmed cases is 50, recoveries there is 10. South Africa, which is the leading country in terms of infections here in Africa, and now they are pushing the 5,000 mark there, standing at 4,996 confirmed cases. The death toll is 93. 2,073 recoveries there have been recorded. And in Algeria, confirmed cases is at 3,649. The death toll is 437. Recoveries is 1,651. And in Burundi, confirmed cases is 11, and 1 person has died and 4 others have recovered. And in Zimbabwe, confirmed cases is 32. The death toll is 4, and recoveries is 5 there in Zimbabwe, which I might add has really done very well in terms of containing the spread of the COVID-19 there in Zimbabwe. Zimbabwe, and in Sudan, confirmed cases is 318, and the death toll there is 25, and recoveries is 31. And in Egypt, confirmed cases is at 5,000. Oh, Egypt is the leading country there. I had not seen the statistics of Egypt, so it has surpassed South Africa. And now it has 5,042, and also I think it's the leading in terms of the number of deaths there, if I'm not very wrong. Let me see the figures from Algeria. The confirmed the death toll in Algeria is 437, and in Egypt is 359. So Egypt right now is leading in Africa in terms of infections, but Algeria is leading in terms of the death toll that has been recorded in the continent, as Egypt's death toll is 359, recoveries is 1,304 there. And in Morocco, confirmed cases is at 4,252. 165 people have died, 778 others have recovered. Liberia, confirmed cases is at 141. The death toll is 16, recoveries is 45. And Chad, confirmed cases is 52. 2 people have died and 19 people have recovered. Burkina Faso, confirmed cases is 443. 24 have died and 146 others have recovered. And in Somalia, confirmed cases is 528. Another cause of concern there from the East African region, with 28 people having died and 19 others have recovered. And in Gambia, confirmed cases is 10. 1 person died, 18 others recovered. And in Cameroon, also another cause for concern there. Confirmed cases is 1,806. 59 people have died. Recoveries is 915. And remember, for Cameroon, perhaps one of the things that could have, factored in terms of why the numbers are high is because it took a while for the government even to ban any, the religious gatherings. We saw until about 3 weeks ago, people are still going to the mosques and to the churches, and that could be one of the factors there that has fueled the increase in numbers there in terms of the confirmed cases there. That stands at 1,806. And in Senegal, confirmed cases is at 823. 9 people have died. 296 others have recovered. And Ivory Coast, confirmed cases is at 1,183. 14 people have died. 525 have recovered. And Emmanuel Malual, yes, keep writing. I'll read that once I'm through with this. And in Ghana, confirmed cases is 1,671. 16 people have died. 188 have recovered. And in Mauritius, confirmed cases is at 334. 10 people died and 303 have recovered. And in Nigeria, confirmed cases is at 1,532. 44 people have died, 255 others have recovered. The DRC, confirmed cases is at 471, 30 people have died, 56 have recovered. And in Congo, Brazzaville, confirmed cases is at 207, 8 people have died and 19 others have recovered. And in Rwanda, confirmed cases is at 212. Rwanda is really catching up, but in a slow space compared to other, countries here in East Africa particularly. And the confirmed cases is 212. Recoveries there is 95. Madagascar, confirmed cases is at 128. Recoveries is at 82. And in Zambia, confirmed cases is 95. 3 people have died and 42 others have recovered. And in Togo, confirmed cases is 99. 6 people have died and 63 others have recovered. And in Mali, confirmed cases is 424. 24 deaths, 122 recoveries. In Niger, confirmed cases is at 709. The death toll in Niger is 31 and 403 people have recovered. And in Ethiopia, 126 cases confirmed, 3 deaths and 50 recoveries. And in Tunisia, confirmed cases is at 975. And 40 people have died and 279 others have recovered. And in Djibouti, 1,072 have confirmed to have tested positive for the COVID-19. 2 people have died, 498 others have recovered. And in Guinea, 1,240 confirmed cases, 7 deaths and 269 recoveries. And in Equatorial Guinea, confirmed cases 315, 1 death and 9 recoveries. And Gabon, confirmed cases 238. 3 deaths and 53 recoveries. And in Libya, the cases now has gone to 61. 2 people have died and 18 have recovered. And I think Libya has been under-reported there. I don't know if they're able to carry out the test, because even the remaining hospital there in Tripoli was bombed a couple of weeks ago. So I don't know the difficulties that even the medical staff there in Libya the challenges they have to overcome even to perform these tests. So Libya, the same as Somalia, we thought was really under-reported, and perhaps the testing was not going on as per the rest of the countries, and we've seen the cases in Somalia going really up. And Libya, I think, is also another place to look out for. But we move to Mozambique, where confirmed cases is 76 and recoveries there is 12. Seychelles, confirmed cases 11, recoveries 6. Sierra Leone, confirmed cases 104, and the death toll there is 4, recoveries is 12. And in Benin, confirmed cases 64, 1 person has died. Recoveries there is 33. And in Eritrea, confirmed cases 39, recoveries is 19. In Guinea-Bissau, confirmed cases is 73. 1 person has died and recovered 18. In Angola, confirmed cases is 27, and the death toll there is 2, recoveries is 6. Musa Morena, thank you so much for watching us from the Gambia. I have not read any statistics there from the Gambia. I don't know what has the Gambia confirmed any cases, of course, because in Africa we only have 2 countries that have not confirmed yet, and that is Lesotho and also the Comoros Island there. It's one of the archipelagos, there in the Indian Ocean. And so let me know the statistics there from the Gambia. Musa Morena, I'd like to know how the statistics stand there from the Gambia. I will appreciate that. So thank you so much for watching us today. And we look at the general statistics, the total here in Africa, and the total number of confirmed cases here in the continent is at 33,627, and the death toll is 1,476. Recoveries is 10,226. Infected countries still at 52, and the various 3 countries are still 2, that is Lesotho and Comoros. And the global statistics so far 3,140,285 confirmed cases today, only 3,777, and the death toll stands now at 218,028, representing about 6.94% of the total number of confirmed cases worldwide. And the new deaths today are at 215. And the people in the critical conditions right now, using the ventilators and all of that, it stands now at 56,322 worldwide. This represents about 3% of the total number of confirmed cases worldwide. And recoveries there, the people who have also gotten better and discharged or are now doing much better, is at 959,630, representing about 30.56% of the total number of confirmed cases worldwide. The number of countries that have been affected by the coronavirus is at 212. And the India right now, the cases there are 31,332. 1,000 people, over 1,000 people have died, and recoveries there is about 7,749. So we've seen the cases there in India going a bit up. I'm interested to see, China. You got us here, and the confirmed cases so far in China, it has not been going really up. So the total is at 82,858. The death toll so far in China is 4,633. Recoveries is 77,578. And confirmed cases today only is 22. And we look at the U.S., confirmed cases is 1,035,765. The death toll is 59,266. Oh my goodness. And you can still see people protesting, wanting the shops and everything else to open. When did a bowling alley become an essential service? These people from the United States, really, I don't understand. With the death toll almost 60,000, can you imagine? And of course, the US, totals up the huge number of confirmed cases, and also the death toll there globally. And Italy, 201,000 28,505 confirmed cases. The death toll is 27,359, and recoveries there is 68,941. So I will not, as I said there, I will not get into the details of that because we've looked at confirmed cases across Africa. Musa Marena still waiting for the Gambia. You only have one case. Oh, that's very good. So President there is doing very well in terms of what are some of the measures that the government of the Gambia has put in place to ensure that they curb the spread of the coronavirus. Please share with us. We might learn something. The Gambia has only one case, and yes, that is very interesting, and perhaps it's something that the people of Gambia, they are doing that is right, that we could learn from, and stop the spread of the COVID-19 across the rest of the African states. Samuel Chaga, you're saying good morning. It is afternoon here, about 20 minutes past noon here in Nairobi, but a very good morning to you for wherever you're watching us from. And a very good morning to you, Michael Valentin. You're saying, even at the time like this, the remaining people running the affairs of Nigeria are using the opportunity to loot the country dry. Even many people who had corona case in Nigeria had nobody taking care of them. Okay, Emmanuel Maloal, you're saying, Miriam, yesterday 28 members were found in one compound plus 6. Now South Sudan has 34 cases in South Sudan. Yes. What are you saying? Like, how many members? Members of what? Of parliament are found in one compound plus 6? Can you please elaborate on that? Because I know, yes, even the numbers there in South Sudan personally shocked me when I was reading this morning, because it just can't come from 5, 6 cases to a whole 34. That looks like what happened there in Tanzania. And is that a cause for us to get concerned for South Sudan right now? And Michael Valentin, I think you're still talking about Nigeria. And you're saying Nigeria will be the worst in this global pandemic because as it is now, Nigeria is a country without a president, and the villa is empty. I'm seeing blood in Nigeria. God help people over there. Is it that bad? Nakomo Misodi, you're saying you're watching from Dubai. Jabulani Majola, you're saying you're watching all the way from Cape Town. Are you safe there, Mr. Is it Mr. who? Jabulani, are you safe there in Cape Town? I know the curfew and the lockdown still continues there in South Africa. Is President Cyril Ramaphosa doing enough to ensuring that the people of South Africa are safe, and how are South Africans responding to these measures that has been put in place? Ishmael Ajay, good afternoon to you, and the rest of you who are watching us, thank you so much. Continue writing even as we engage. And you're saying the government of the Gambia, they are doing a good job. All right, so kudos there to President of the Gambia. I'm forgetting his name. I almost said Yaya Jammeh, then I remembered, no, that one was removed. Yeah. So thank you so much, Musa there. So now let's just get into what else is happening here in the continent. And if there's a news out there that you think that we should know, please kindly feel free to share in the comment section there, and I'll be happy to read for the rest of us. So we start with Uganda, where Ugandan's President Yoweri Museveni has blasted members of parliament for allocating themselves a total of 10 billion Ugandan shillings, that amounts to $2.6 million to raise awareness on coronavirus. Hold on. The members of parliament in Uganda has allocated themselves about $2.6 million, that is about 10 billion Ugandan shillings, for them to create awareness on coronavirus. Because why? So the president said it was morally reprehensible for the MPs to allocate themselves the amount instead of funding district committees created for that purpose. Yeah, thank you there, Musa Marema. Yes, President Adama Barrow, I had forgotten his name there. Thank you so much. We talk about him so much here on this show. I don't know why I've forgotten about the name of the Gambian president. But here in Uganda, members of parliament have voted to allocate themselves $2.6 million to raise awareness on the coronavirus. And President Yoweri Museveni is not very happy at all, not amused at all by this move. And so still in Uganda, let me know your thoughts on this. I'm telling you, still in Uganda, and Ugandan opposition presidential candidate Bobi Wine accused the police on Monday of torturing and blinding one of his allies shortly before the lawmaker detained over coronavirus social distancing rules was brought to court on a stretcher. Wine, a pop star whose real name is Robert Changulanyi, is seeking to oust aging leader Yoweri Museveni, who is 75 years old, in presidential polls due early next year. One of Wine's leading supporters, lawmaker Francis Zake, was detained on April 19th by police who accused him of committing a negligent act likely to spread an infection of disease, an apparent reference to the coronavirus. And then we move to Nigeria, where a Nigerian man put up for sale a Nigerian woman. Let me tell you, the first time I read this story on the BBC, I was really mad. But all right, it appears that help is on the way here. And a Nigerian woman put up for sale on Facebook in Lebanon has been rescued days after a man suspected of involvement in the advert was arrested. Now, the social media advert of the woman caused an outcry in Nigeria. The chairperson of the Commission for Nigerians in the Diaspora, Abike Dabiri Erewa, told the BBC that the 30-year-old woman is now safe at the Nigerian embassy in Beirut after she was rescued by the Lebanese authorities. Mrs. Dabiri Erewa did not give details of how the woman was rescued, but said the lockdown imposed by the Lebanese authorities to fight the coronavirus pandemic helped in tracing her. So her former employer took her photo and I think her passport picture. I was looking at it and placed it as an advert for if you want a slave or you want somebody to wear a house help or something. You go and he was selling this woman at $1,000. That is really despicable. And we move to Malawi, where Malawi's President Peter Mutharika has announced an emergency cash transfer program for the people worst affected by the COVID-19. Eligible households will receive a monthly payment of 35,000 Malawian kwacha, which is equivalent to $47 through mobile cash transfer starting in May. And the announcement came after the High Court in Malawi extended an order preventing the government from implementing a 3-week lockdown. The level of, I don't understand, here in Malawi, we've seen a lot of countries that have been able to, curb the spread of the COVID-19. One of the measures that the government's running quickly to put in place is to contain movement and the curfews and the partial lockdowns, and to see a human rights body. And I don't agree with President Peter Mutharika a lot of times. But on this one, I think even sometimes the human rights defenders, they just go out of their way, and I don't know for what reason. They went to court to stop the president from announcing that there will be a partial lockdown or restricted movement in Malawi. So they've suspended that until the president made that decree. So they went to court and they challenged that, and the court upheld this announcement. Rubbished the president's decree on having. Directive on having a lockdown there in Malawi. So you're thinking, who will be affected? It is the people, and I think these measures are put in place to ensure the COVID-19 does not spread. So for the human rights groups to go to court and challenge this, and now the lockdown will not be implemented for the next 3 weeks. Who knows in 3 weeks how much this disease would have spread there in Malawi? And even as we see that, I think the country is still looking forward to go into the re-election. Remember, President Peter Mutharika's re-election there was challenged, and of course. The verdict was made on 4th of February this year, and the country has to go back to an election in next month. And even with the threat of the COVID-19, they've not called off the election, so it shall continue as it has been scheduled before. And we move to the Ivory Coast, and the Ivorian president candidate and former rebel leader Guillaume Soro has been convicted in absentia of embezzlement and sentenced to 20 years in jail. He was fined the equivalent of $7.4 million and barred from civic duties for 5 years. Ivory Coast is preparing to go to an election, right? Okay, so the trial was boycotted by Mr. Soro's lawyers, who said the allegations against him were political and aimed at excluding him from this year's presidential poll. And Mr. Soro, who lives in Paris, was accused of using public money to buy a house in the commercial capital, Abidjan. The property has been confiscated by the court. And we go to Libya, where the United Nations has accused the authorities in the eastern Libya of breaching the international human rights obligations by expelling migrants and refugees. A UN official said 1,400 people have been deported since the start of the year. Nothing was done to ensure the protection as they were returned to sub-Saharan countries like Sudan and Somalia, where they might face persecution. And we move to Burundi, where images of thousands of people mingling at political rallies in Burundi on Monday have sparked concerns that coronavirus infections could soar. Olivia Manzi, a specialist in infectious diseases, said large gatherings of this nature risk accelerating the spread of the coronavirus. Official World Health Organization advice during the pandemic is for people to observe social distancing to prevent the virus from spreading. Another is to regularly wash hands. And Burundi's Electoral Commission did provide buckets and soap at the ruling party rally in Gitanga and the main opposition event in Gozi province. Hold on. So Burundi's Electoral Commission. All the things that happen in this continent are just wonderful sometimes and confusing at the same time. So the Burundi's Electoral Commission is now mandated to provide buckets of water and soap at political rallies. Why are we having, let me just read, the cases in Burundi right now is at 11. One person has died and 4 have recovered, which is a very good move. I wish the government would have just waited. Burundi is also set to go to its elections next month. President Nkurunziza, will be replaced. He was already given a retirement package there, a nice house and some money, about $500,000 US there. And the cases are quite low, so that is very commendable over the measures that the government has taken. But why are they having rallies right now at this point in time? Could they not wait another 2 weeks until these people have gotten better and they don't record any more cases, And so I saw the images and I was shocked myself. You'd see huge numbers of people and they didn't even have masks, majority of them. And so assuming just one person there had coronavirus, the potential of so many people getting this a virus over there is just on the high. And to think that now Burundi's Electoral Commission role here, providing buckets of water and soap, I don't understand how that works. I don't even know why that is the responsibility for the Burundi Electoral Commission there, but hey. We move to Lesotho, where Lesotho Senate on Tuesday further increased pressure on Prime Minister Thomas Tambane to resign by limiting his power to dissolve parliament and order new elections. The small kingdom has been going through a serious political crisis since Mr. Tambane was implicated earlier this year in the murder of his ex-wife 3 years ago. His own party, All Bosoto Convention, ABC, and those of the ruling coalition have been demanding his departure. But the head of government is clinging to his post and has only promised to step down by the end of July. In this climate, persistent tension, the Senate on Tuesday adopted a constitutional amendment which, among other things, requires the head of government to obtain the agreement of a majority of parliamentarians before proposing to the king the dissolution of parliament and the organization of new legislative elections. All right. Mr. Tambane has refused to step down. Okay, so we move to Algeria there, where on Monday the country extended until 14th of May the containment measures to curb the spread of the new coronavirus after authorizing the reopening of some businesses during the Ramadan period. Prime Minister Abdelaziz Gerard has renewed for an additional period of 15 days, namely from 30th April to 14th May, the current containment measures as well as all preventative measures. His outfit said in a statement, Mr. Gerard called on his compatriots to continue to observe conscientiously and rigorously the measures of hygiene, social distancing and protection, according to the statement. And then we go to Morocco, where more than 300 cases of people infected with the COVID-19 were detected in 3 prisons in Morocco. More than 300 people. more than 300 cases are detected in the prisons, 3 prisons in Morocco, after a screening campaign conducted in 73 prisons of the kingdom, prison authorities said on Tuesday. Out of 1,736 people subjected to screening tests in prisons, 313 cases of containment have been recorded so far. Contamination has been recorded so far in the prison of Ozazate, that is in the south of Morocco. 303 positive cases have been recorded, 241 inmates and 62 civil servants, according to a statement by the General Delegation for Prison Administration and Rehabilitation. And we come back to Nigeria again, where the Nigerian Center for Disease Control on Tuesday said it will target testing 2 million people in the next 3 months. In the next 3 months, it will be testing 2 million people. So Nigeria is still hoping to be having this illness in the next 3 months, not even 3 weeks. I thought Nigeria had the capabilities, being one of the leading economies here in Africa. You know, so Nigeria is targeting to test 2 million people in the next 3 months. And the NCDC DG, Dr. Chikwe Inekwezu, who said this at the Presidential Task Force on COVID-19 media briefing in Abuja, also said it cost about $18 to $20 to test a COVID-19 sample. All right. And we move to South Sudan, where South Sudan has recorded 28 new cases of the coronavirus pandemic. Vice President Dr. Riek Machar has announced. Now, Dr. Machar, who is the deputy chairperson of the high-level task force of the COVID-19, announced the new cases in Juba Tuesday evening. A total of 139 people who were tested for the virus in April 29th, according to the task force. Of this, 28 cases were confirmed positive, while 10, including 2 truck drivers at Nimule border crossing, were equivocal and need a retest, reads a statement in parts. Now, this brings the total number of coronavirus patients in the country to 34. And on Sunday, the Coronavirus Prevention Committee announced the 6th patient whom it suspected might have come into contact with 101 people before he was quarantined. So if this one person in South Sudan had come into contact with 101 other people, and these 101 other people have come into contact with other people, what are we expecting to see here in South Sudan? Oh boy, now that is very worrying. And we end with Madagascar, where police in Madagascar's capital Antananarivo are enforcing new rules requiring citizens to wear coronavirus masks outside their homes by enforcing violators to clean the city streets. The new rule went into effect on Monday, and citizens who were caught ignoring it could be seen in the city sweeping streets and picking up garbage. President Andre Rajoelina has made it compulsory to wear masks coverings outdoor in the capital and other major cities as a condition for the gradual lifting of lockdown measures in those areas. Authorities have warned citizens that those leaving the house without masks would face community service. And Madagascar, right now 70% of the people out and about in the capital obeyed the rule. So about 70% of the people there in Madagascar have actually obeyed this rule. Thank you so much. Let me just read a few of your comments before we get into it. Musa Marina. All right. Hold on. Let me just read something from Emmanuel Malwali, saying South Sudan is really vulnerable when coming to COVID-19 because our politicians are not focusing on health issues, the common issue to be discussed, only number of states between government and opposition, no health issues. And I think, I agree with you on the fact that South Sudan is very, very vulnerable right now when it comes to the fight against the COVID-19. And that's why when I'm reading these numbers here, I'm worried. And to know that one person that tested positive for COVID-19 came into contact with 101 other people. So I'm just sitting here and thinking, these 101 other people, in case all of them contracted COVID-19, which I hope not, they also went ahead and had contact with other people. So where would that, how will those numbers add there for South Sudan? And also Musa Marena, you're saying the one who died in the Gambia is not Gambian, but from Bangladesh. Michael Valentin, you're saying, please, I came across a video going viral from Senegal where many of Africans were kept in deportation camp. Their crime was not having a visa. And why will people in Africa discriminate Africa? Also, what message are we giving the white people? Are you okay? So there have been those cases there. So I've not come across this video, but what I'm hearing you to be saying, Michael Valentin, is that some Africans were being put in deportation camps there, and they're coming from other African countries. And is it the same case that we saw, the xenophobic attacks and acts that we saw in South Africa? And if this is happening really in Senegal there, then we must rise as the rest of Africa and really speak against such things. We cannot expect people from outside of the continent to treat us, demand for respect, of us as Africans, and we don't even give the same to our fellow brothers and sisters here in the continent. So we have to stand and speak up against such ills that are being meted against our fellow African brothers and sisters. That is not right. Should that be the case? And also Emmanuel Malwal, you're saying South Sudan needs help from global and international community because we have no health facilities. Since creation of Sudan, before becoming independent in South Sudan. And I understand where you're coming from, because South Sudan went into war just 2 years into independence. South Sudan got its independence in 2011. In 2013, the war broke. So it had not put really structures in place for it as a country to really be that independent and to make sure that these important things like hospitals and proper education facilities and just a general infrastructure of the country was put in place. So South Sudan did not have that opportunity to build some of these things from the ground up before it went into the civil war that lasted a good 7 or so years there until the rival parties decided to have that handshake and to sign the dotted lines in when was it? Is it 28th? Is it 18th of February this year? I've forgotten the deadline there. Is it the 12th of February? I think one of those. So we've seen, so it is understandable. South Sudan is very, very vulnerable, and I agree with you there, you're saying the government only invested, and the money that the government was receiving, you're saying invested in guns. And President Salva Kiir himself came out last year and said he was attending. Was he attending? No, he was the National Prayers Day there in South Sudan. I remember after he had come from Kenya, from our National Prayers Day, and there was a national event in South Sudan. I don't know if it was Independence Day or something, but it was an important day in the calendar of South Sudan as a country. And the government actually acknowledged that President Salva Kiir expressed regrets that even the money the country has been receiving has been channeled in the wrong places, and that is to support the war that was between him and his vice president there, Dr. Riek Machar. And so he acknowledged that that is a mistake that he had done as a president, and so he will seek to do better. So I don't know if he's doing better now, but we've been following the cases in South Sudan. We've been following the stories there in South Sudan until the handshake and until they signed that peace agreement in February. We've been on the case of South Sudan, but right now not so much has been happening. And then after that, they started now fighting over positions there. And I was really disappointed, but not surprised. I saw that coming, because all along, this war that has been existing in South Sudan has nothing to do with the people of South Sudan. It has been a war of ego. It has been a very selfish war. These leaders looking out for their own interest. And so I was not surprised that even after signing that peace agreement, they did not even look at the security arrangement, which is also one of the pertinent issues that they were supposed to have looked at and solved before, forming this unity government that would have necessitated the smooth transition and bringing all these differing camps together. So we did not see that happen before the signing of the peace deal there, but the peace deal had to be signed anyway. it was a good step towards realizing a lasting solution there in South Sudan. So that is still also pending, and I did not hear them talk about it. So now last week, I don't know if you were watching last week here when we were looking at, the wife of Vice President, who was also the Minister for Defense, and yes, Defense and something, I can't remember the other part of that title, Angelina Teny, who is the wife of Mr. Riek Machar there, refusing to show up at the committee. She was summoned over some issues that had to do with national security, and being the CS, the Minister for Defense, I think her docket was responsible for that, and she did not show up. She said the current parliament has no jurisdiction in calling her. She's not answerable to that, so she did not show up. And I was thinking, well, even if she thinks the people don't have the jurisdiction to call her to go to the committee and be answerable to them, then maybe she owes the public there in South Sudan and tell them what's happening. She should have issued a statement through the media there or whatever, so that South Sudanese know that their borders are safe and things like that. And she was doing whatever she could in her position as a minister in that country to carry out her duties, and she owes the people and the population there in South Sudan. So it's very interesting, and yes. So I don't know if President Salva Kiir will do anything different in terms of now channeling the money towards the priorities, the things that really matter to the people of South Sudan. Moses Kimiza, you're saying, hello, Miriam. Thank you for the work you're doing. Thank you so much. And you're very much welcome. And thank you for watching. And you're saying, my issue is the African government not doing enough to our fellow blacks suffering in hands of Chinese in China. And was the African Union stand on the same? It's very, very interesting that you could bring African Union into this, and I'd not even thought about it in regards to these cases that we see happening there in China. And I'm happy to say that the Kenyan government yesterday came out and said it is finding ways and devising means in which they can bring back the Kenyans who have been affected from China back here, and also from India who are stuck there. A lot of Kenyans go there to seek, in India especially, to seek for treatment, especially when it comes to cancer treatment and other ailments. It's cheaper over there, and then I don't know, it's just, yeah. And also the cartel industry in the health ministry, they sort of work with hospitals over there and agents over in India. So for very suspecting Kenyans who don't know this, you're told, you know what, yes, but you're sick, but you'll get a cheaper and better treatment there in India. So we see a lot of Kenyans going to seek for treatment there in India. So a lot of them were stuck there even after getting better, and so they could not come after the flights were halted and all of that. So Kenyan government is trying to bring these people back home from India and also from China, who found themselves in this very unfamiliar territory and mistreatment. So I personally, and I have been consistent with that, I was not very happy. I'm not happy with how Africans are being treated there. They're still out in the streets. And I agree, and I'd like to understand the position of the Chinese government. They're coming out and saying, a lot of these Africans, they don't have proper documentation. A lot of these people, they don't have this and this. So there are a lot of legalese matters, and that can be addressed after. My issue is, can you not put them out in the streets? It's very cold right now, and even the risk is much more. You're trying to fight COVID-19, but you're putting these people in even a much bigger risk. If one of them has the COVID-19, then all of them are likely to get it when they're bundled out in the streets like that. So they could have provided a safe place for them to stay there, because they're not even allowed to go to the shops and buy anything. They're not allowed to access any public service, enter a supermarket, enter a bank. So now what do you want them to do? Can you put them somewhere, ensure they're fed, ensure they're safe, and then after the COVID-19 is over, and then now you can take up this matter and deal with the legal part of those who don't have, legal status of staying in China. Just deport them back to their countries. But we know right now it's not really possible for these people to come because of what the world is on a lockdown. And so the Kenyan government, I'm happy that they took this responsibility and this initiative to ensure that Kenyans who have found themselves in this and very unfortunate situation are able to come back home safe and sound. So that is a very important thing, and I'm happy that the government of Kenya do that. So I'm just hoping the rest of the African governments can follow suit and do right by their people. And China, please do right by the rest of us. It's not our fault. Remember whose fault this is, and we shall deal with that. I think after the COVID-19, China owes all of us an explanation of what is really happening. And Sidonio Jivandas, thank you so much for watching. You're saying IMF, African nations, including Mozambique, have become heavily indebted in the past decade and are seeking support from the IMF, World Bank and European Union for wide-ranging debt relief. Approves 309 million in emergency financing to Mozambique to address the coronavirus hit. So you're saying IMF, sorry, let me just get some water. You're saying IMF has given some debt relief there for Mozambique. I think it's a good thing. But also on the point there about the Africans who were stuck in China, I think I forgot something there. I have not seen African Union come out and address this matter. I've not seen African Union come out the way they came out, and when Mr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, after Donald Trump came in and started hitting hard on him. And I saw Moussa Faki, the chairperson of African Union. I saw President Cyril Ramaphosa, the current African Union chair. I saw President Kagame come out, and I saw who else? And a Zambian president come out, and they were telling off Mr. Trump. But I've not seen these leaders come out and speak. I've not seen South African president come out and speak as the chairperson of African Union. I've not seen the leadership. I've not seen Moussa Faki come out and address this matter about the Africans who are suffering in China. I've not seen them come up and say this is wrong. As much as a lot of them could be on the fold, but it is wrong from the human standpoint, from whatever. It is wrong, it is wrong, it is wrong. I've not seen African Union come out and address this matter. So I'm happy that you, thank you for bringing this up, Moses Kimeze. And yes, African Union, I think it's just a letdown to this continent. But we've been running a clip here by Ambassador Rikana. I remember the ambassador that was fired. She was the AU ambassador to the United States. The bold speaking, ambassador, and she came out and she was addressing this on social media. And no wonder they could not keep her, the African Union, because if you're bold and you're African to the bone, I don't think you can work in the African Union, because a lot of times they suck up to the masters. Emmanuel James Cole, you're saying government of South Sudan is become COVID-20 to people. God have mercy. COVID-20? We have COVID-20 now. Emmanuel, you're saying the government of Sudan has become COVID-19 to the people. God have mercy. Why? So you're saying the government of South Sudan has become a virus to its own people. Why would you say that? Abraham Wangila Wafula, thank you so much and nice to see you. It's been a while. And Musa Marena, you're saying, sister, really, Gambia, we have no COVID-19 in the Gambia. I tell you this, I know everything is going on well. Oh, that's very nice. What a relief. So your lives have not been affected. You don't have any curfews. You don't have any lockdowns. You don't have none of that. Face mask wearing in public. Us here, it has become part of us. And so, John Clark, a very good afternoon to you, and thank you so much for watching. Dandada Nankata, you're saying right on. All right, thank you. Adobina Nku, you're saying please let all African country buy our African brothers product. I mean, the COVID-19 cure from Madagascar is our own. Let us promote our product from Africa. And it is very important that you brought this. And also in Madagascar, it is said that 70% of the people there are actually adhering to the rules and the measures given by the government. President, Rajolina, there in Madagascar, Andril Rajolina there. He's a former DJ, you know that. And so Madagascar produced some medicine, they say, has treated at least 2 people there. In Madagascar, and they call it the COVID Organics. All right, it's a very interesting name there. So they said it has treated 2 people, and it's from a plant, and this plant has been known to treat malaria there in Madagascar. So it is encouraging. So Obina, you're saying this could be the solution to the rest of our problems in the world, not just in Africa. All right, very well. So yes, we need to support that. And also President Rajolina said for anybody going to school, back to school, you have to take a bottle. I don't know how they measure the prescription. Is it you given a whole 1 liter? I don't understand, because it's a herbal medication there. The COVID, they're calling it the COVID organics. An interesting choice of name there, so it's very important. So yes, any invention from Africa, I think yes, we should support it, but let's see how that is working for the people of Madagascar, and then we see if we can buy enough of that over here and across the globe. And Jimmy Jaita, you're saying all the leaders are all working for their own interest and not considering their citizens. I don't know which country you're writing me from, Njime, and please let me know where you're writing from. And Dundi Umi, you're saying treatment, Chinese method on Africans and creation of coronavirus by China has exposed the thinking and how much hatred they have on Africans and how they want over African countries, and shows that African Union does not exist. I don't know, from this COVID-19 and how Africa has responded and how Africa has found itself by itself, because usually, even for the things that we could do for ourselves, our leaders are always very quick to go out there and seek for help and seek for word, and sometimes it's embarrassing, to be very honest with you, because I think the things I always believe, I mean, we can do that for ourselves, but our leaders are always very quick to go out there and seek for money and seek for all these loans and then come here and steal through corruption. Doesn't really get to help us that much. But at this point, we've seen the countries that we depend on the most, they're dealing with their own problems in regards to the COVID-19. So we've not received a lot of help from them. But also this has forced us as Africans to look inward and try to find solutions here in the continent. So moving forward as Africa, do you think we have learned? Do you think this over-dependence of our former colonial masters, the Western world and China and all these people who are now scrambling to come back to Africa. We are like in the second scramble of Africa as we speak. If you've been watching the interest these superpowers and these world economic powerhouses have been having in Africa, and you can, I'm worried because they come in with all these shiny things. Are we going to build your roads? Are we going to fund your education system? Are we going to fund your elections? We can't even fund our own elections. Can you believe that? And we are independent so many years later after gaining independence. I think it's very sad and very shameful sometimes. But you see, after they come with these very nice goodies, a lot is at stake and we don't realize that. But from this COVID-19, do you think Africa has learned something in terms of over-reliance of help, over-reliance of aid, in terms of, just depending on just about everything to come from outside and the big brother? Is it time that we realize that actually we have the solution to a lot of our problems over here, because now we found ourselves by ourselves. Very few countries are receiving help from outside. At the end of the day, governments have been forced to reconsider their budgets, as we were looking in the earlier show, and how much even in Kenya here, the government of Kenya has been forced to relook its national budget and cut on some things. Can we devise ways in which we can be self-sufficient here in Africa, and moving forward, can we really stand and say, from this day moving forward, Africa, we want, as much as we say we are independent, but now we want to also act independent and try to solve our own problems, try to find our own solutions, and try to just govern without interference from outside. There, Abraham Wangila Wafula is saying President Nkurunziza has put Burundians at risk of allowing campaigns to go on as usual. And you know what? You're very right about that, because I don't understand, as much as Burundi has recorded very low cases, and that is really commendable. The rallies and the photos and the images we saw from that rally. And then the Burundian Electoral Commission had the responsibility of placing water buckets and soap. How is that even their work? How is Burundian Electoral Commission, which is supposed to be organizing for the elections, The elections in Burundi are coming up in May there, as I said earlier, and also the elections in Malawi. And also in Malawi, President Peter Mutharika has said these elections will continue. So look at, in Malawi, the High Court has refused the government to put on, the restrictions, the partial lockdowns there in Malawi. It has been suspended until after 3 weeks. Can you imagine after 3 weeks? What could happen after 3 weeks in terms of infections there in Malawi? And who are these right-thinking people who would go to a court to stop, such a move? Because this is not the time, and I usually support, some of these human rights, groups, but this is not the time because this lockdown, when we see the countries that have gone to partial lockdowns and these curfews, they have been able to really curb the spread of the coronavirus. So I agree with you there, Wangila. Burundi President Nkurunziza, although he's not coming back, you know that, it is the Secretary General of the party that had him in power, his party that will be running for the presidency there in May. So President Nkurunziza agreed to retire. He was given a considerable, a good retirement package there. And Joseph Otto, you're saying, can we drink the Madagascar medicine? Seems African countries are ignoring the drug. They would have run to the West if the drug was discovered there. Very well. Joseph Otto Manasseh, you have a point. It's like anything that we don't even believe in our own selves, as long as it's from Africa. I mean, how can I take COVID organic? The medicine from Madagascar is called COVID organic. How can I take that from Madagascar? But if you hear Japan, because also Japan had said it will give us some herbal remedy that it has been using, and I saw people are very welcome to that suggestion by Japan. But it's very unfortunate that we don't talk enough about the medicine that has been discovered there in Madagascar that could have the potential, to save all of us from this COVID-19 and. Very interesting. The problem is that you cannot take a DJ seriously. Oh my goodness, President Andry Rajoelina. But the people of Madagascar must have seen something in him in terms of leadership for them to have elected, him as the president there. But yes, the COVID organic there in Madagascar. Perhaps Africa should start paying more attention to our own inventions, to our own, and that's why, and it's very interesting because even yesterday, one of the newspapers here in Kenya, the headlines was one of the Kenyan doctors who is based in the US. They discovered a medicine, a HIV medicine that will be injected for the ARVs that will replace the daily ARVs that the people who have the HIV and AIDS take every day, and you'll be injected and once a year, and that's it. So that's a major discovery in the world of medicine. So this Kenyan doctor and scientist is based in the US. If at all he was here, maybe he would not have discovered. The conditions might not be very favorable to support local inventions, but we have excellent minds here, and because we don't have that room and the conditions necessary for such people to thrive are not there, so they go thriving outside there, which is a shame, and as an African I'm not very happy about it. And Dundi Ome, you're saying until Africans dismantle neocolonialism and dictatorship, Africans will continue to suffer from misrule and misery of all the leaders have imposed on them. And Samuel Chaga, you're now also saying that, yes, Miriam, our leaders are shaming us. Most of us can't imagine from stealing the money went for hospitals, then spend the same money to get your treatment from the same country you borrowed the money. Yes. And yesterday, you know what? He just took the words out of my mouth. So use the money that has been given from these countries. You take them and you don't use it for the purpose that was meant. And then you take it back to them when you go seeking for treatment in their countries. An oxymoronic thing to do there that we see most often in the continent. So now our leaders are locked down with us here. They cannot travel for their treatments abroad. Right now, you'd have had President, Buhari, who's always out of the country to go seek for treatment. I don't know which other president and the other one and the other one. They are never treated here in this continent. And that said, they've not been in touch with the poor health systems. So yesterday when I was reading the news and that story from Ghana really caught my attention, I didn't know whether to laugh or just be sad as an African. where now President Nana Akufo-Addo was saying now, after the COVID-19, the country is set to build about 90 health care hospitals, 90 hospitals. And I was just thinking, did it have to take COVID-19 for President Akufo-Addo to realize the country's health system there in Ghana is lacking? And even the existing health facilities are not funded, are not in good working conditions. They don't have the majority of the things that is required there for proper treatment and for care for the people there. So I know, come on now, we must demand for better here in Africa. We are so used to mediocre leadership that we have become very complacent on our part, that we don't demand for better. And I think that is the problem. I think Africans, we've just resigned into putting up with these people who don't even deserve to be leading us, majority of them, to be honest with you. And Michael Groans, you're watching us from Germany. And Abraham Wangila, you're saying a vegan, a drug manufactured by Japan for influenza, showed better results when it was used to treat COVID-19 patients not in critical condition. Instead of the initial 11 days of recovery, they recovered within 14 days. That's very good, yes. And that is a drug that I think Japan, I think Kenya at some point wanted to test out this drug over here. But now we have health. Help is on the way. Not too far away, Madagascar, just down there after Tanzania. Can we test that? We have help here in the continent. Why are we not supporting the DJ president, Andre Rajoelina there of Madagascar? And the people of Madagascar, I see it packaged in like it's some juice or something in a bottle, 500 ml, 300 ml. I don't know if they have a liter, but I've seen the images of that. So you drink, I don't know how much you're supposed to drink. I don't know you drink how many liters in a day, or I don't know. I'm not sure how much you drink of that, or a spoonful. With herbal remedy, sometimes you really, I don't know how you prescribe that. But he said people there have to drink it, and the cases there in Madagascar. Let me see how many cases there. Perhaps if you've seen how many cases there and seen how many recoveries there, then maybe that will encourage us to want to take this COVID organic. That is what they call it. All right, so confirmed cases in Madagascar is at 128. Recoveries there is 82. So maybe the COVID organic is working. I don't know. I'd like to see this broken down to me. You know what? I'll give myself some homework. I'll go see how many patients this COVID organic has been able to treat so far there in Madagascar. There you go, the bottle there. And now the United States has said it will fund the Madagascar herbal treatment after World Health Organization disapproves it. Of course, World Health Organization has to disapprove it. They're working with major pharmaceutical companies who will not agree some herbal medicine to get an approval from the World Health Organization, because that will mean they will lose business. At the end of the day, these pharmaceutical companies, they're there to make some money. So anything that threatens, you think, and the way we see the inventions in the world, even medicine for cancer and these other terminal illnesses have not been found. No, it is because they know that they will be out of business should solutions to some of these illnesses that are really costly be found. So, of course, World Health Organization, with all the scandal and with all the reluctance it's been having in terms of even giving us the right information at the right time, what do you expect? So World Health Organization dismissed that. But we see there number 45, Mr. Donald Trump, coming in and supporting and funding the production of the COVID organic there. And Musa, you're saying, Miriam, how can I contact you? I want to give you some news about my country. You can just write it here in the comment section. See, I'm reading everything. Musa, just over here, so that all of us can know what is happening. Or you can go to Punchline, and send it to Punchline Africa, our page there, and just send us a message and we shall get in touch. But usually just over here, because we engage together, we get to learn and we get to share the information. I tell you what I've researched on, and you tell me what is out there that I don't know about. Sidonio Givandis is saying, do you think Uncle Bill accept that Norway All right. So thank you so much for your time. My time is about up. So you've looked at the news from across the continent, and of course, one that really I'm not very impressed about, these members of parliament for Uganda who have allocated themselves about $2.6 million to raise awareness on the coronavirus. Why are they the ones who think they can raise awareness about the coronavirus? What is the national government doing in terms of creating awareness? Because I've seen here in Kenya, the government has been working, and even other private sectors have joined in their support of the efforts that the government has put in place. And we've seen private firms coming out and issuing alerts and creating awareness and all of that. And the media in Kenya has been very wonderful in terms of cooperating and creating awareness. So why do members of parliament in Uganda require all that money to raise awareness? This is another way of corruption. And President Yoweri Museveni is not very happy about it. And I wonder why, because these are the same people who keep stamping some of these very not so good bills on his behalf. President Museveni, these are the same people who stamp all your ridiculous bills that you bring in parliament and they pass it. So now you're mad because what? They want some money that, of course, will go to their pockets. They will not create any awareness because how are you going to account for that? So he's mad, and these are the people that he has created there. And I'm sure a lot of them are even from his own party. So thank you so much. And that woman who was being sold on Facebook, the Nigerian lady who was being auctioned on Facebook by her Lebanese employer at $1,000. It's disgusting. And of course, the Nigerian embassy there in Lebanon said that they have relocated. They have taken the lady and they have traced her, and they have her in their embassy there. Africans, even as we know, it is tough times here in the continent, and sometimes we are forced to go out there and look for employment. I hope that even as we do that, we ensure that our safety has to come first. So thank you so much. Moses Kimenze, you're saying at least in Ghana, after COVID-19, the president realized the need to build hospitals. But in Uganda, the budget want to buy military hardware, yet they don't have war in healthy. Number 4 in Uganda budget 2020. Okay. And also but Moses Kimenze, my problem is, did it have to take the COVID-19 for President Nana Akufo-Addo to realize the health system there in Ghana is in dire need? So are the rest of the health systems in Africa, which have been tested to the max. Did it have to take the COVID-19? Does it mean that our leaders are so out of touch with what is happening on the ground that they require a crisis for them to know there is a problem? Well, that is a good thing, but also, come on now, it's not right. All right, so thank you so much. We shall see you here at 2 p.m. We shall be back with another show. My name is Miriam Ogutu. A very good afternoon.
Peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.